Through the Universal Health Coverage Project of the Ministry of Health, Wellness and Nutrition, staff of the Home Caregivers program will receive palliative care training. Palliative care is a specialized medical approach aimed at improving the quality of life for patients facing serious, chronic, or life-limiting illnesses. The need for palliative care in St. Lucia is increasingly urgent due to demographic changes, the prevalence of non-communicable diseases, and existing gaps in healthcare infrastructure. St. Lucia, like many Caribbean nations, is experiencing a rise in non-communicable diseases such as cancer, diabetes, heart disease, and respiratory conditions. These illnesses often require long-term management and can profoundly affect patients' physical, emotional, and social well-being. Dr. Alicia Eugene Ford, Director of Health, speaks on the timeliness of the workshop and the continued implementation of universal health coverage in St. Lucia.
The Ministry of Health, Wellness and Nutrition received a request from the Ministry of Equity to train the recently appointed home caregivers in palliative care under universal health coverage. The palliative care training, Ministry of Health, we started this from last year, but this year we've made the agenda even more robust, where we have health care practitioners from the private sector coming on board, the public sector, from primary healthcare level, the hospital, etc., coming together under the leadership of Dr. Owen Gabriel to be able to provide a robust palliative care agenda or program for the home caregivers.
This is part of the UHC agenda to provide promotive, preventive, curative, rehabilitative, and palliative health services that the public needs.
Universal health coverage, we know that a lot has to do with prevention, but it also takes into consideration promotion, prevention, treatment, rehabilitation, and palliative care. And in palliative care, what we really want is for persons to live longer, as comfortably as possible and as healthy as possible. So this agenda will allow the home caregivers to be well trained, to take care of their clients and also take care of themselves when they do the good work that they're actually engaged to do.
In 2025, 2 caregiver palliative care capacity building workshops were successfully conducted. Coming out of the overwhelming achievements of these, a 3rd workshop was held for healthcare professionals. In the latter, experts and palliative care professionals from Massachusetts General Hospital and Harvard Medical School stood alongside local consultant oncologist and palliative care physician Dr. Owen Gabriel, as well as consultant geriatrician Dr. Beverly Gabriel from Lancaster, Pennsylvania Veterans Hospital, USA. Now, in 2016, Dr. Gabriel is back to conduct a further 4 days of training.
Today is day 1 of what I think will be an historic occasion in St. Lucia. We applaud the efforts of Universal Health Coverage and the Ministry of Health for continuing this training of elderly caregivers, which began last year, and the introduction of palliative care in St. Lucia. So what we intend to do is to engage palliative care practitioners and elderly caregivers on the island to train them on the day-to-day skills and techniques that must be used in order to achieve quality outcomes in our elderly patients. One of the objectives will be to enhance their skills and also to reduce the readmissions to our hospitals and therefore reduce the burden on our emergency rooms and our wards.
Mildred Joseph is a participant of the palliative training workshop. She says this initiative is timely as the permanent staff of the home health program require continued support through training opportunities.
Education is never too much, and every day you get to know new things about the elderly because that is important. I know for sure my colleagues will definitely take in what is being taught throughout this training, okay, because it is important. The more they learn, the more they can execute on their duties to the elderly. That is important.
The workshop aims to enhance caregivers' understanding of best practices, promote patient dignity, and foster a supportive care environment. Jade Brown, Universal Health Coverage.